I'll be talking about a concept which is very important in forensic medicine is that after doing autopsy, many times we preserve small pieces of all the organs of a body and send it to histopathology to see the microscopy of the organs. Now, in your Viva exam, the external can ask you what is used to for tissue fixation and for preservation of these organs. Once you have dissected out these organs from the body, you want to send it to the pathology lab. What is the material where you will which you will use to preserve and to fix the tissues? Now, students who have studied little bit of forensic medicine, average students, they are going to say formalin is what is used. A better answer would be 10% formalin, but the best answer is 10% neutral buffered formalin. Now, what do you mean by 10% neutral buffered formalin? Let's break this down. So, 10% is the amount of dilution. Means if there is 100 ml of formalin which you are using, 90 ml is something else, a dilutant, and only 10 ml is the actual formaldehyde concentration within it. Now, what is neutral and buffered? Now, first I'll tell you what do you mean by buffered. Buffered means we add some buffers which neutralize the pH of the solution. So, in order to maintain a neutral pH, we add some buffers. It can be acids or alkalis. So, whenever you are adding some buffer to a solution, it is called as a buffered solution. You add the buffer to maintain a neutral pH, it is called as a neutral buffered solution. So, what do we use? We use 10% neutral buffered formalin for fixation of organs before microscopy. Now, if you are preserving all the organs, what is the amount of this preservative you will use? Remember the 6x rule. 6x rule. If the amount of tissues comes up to volume of tissues comes up to x, the amount of formalin you will use will be 6x, which means 6 times the volume of the tissues. But what happens many times in practical life, in many mortuaries, is that they tightly pack all the tissues with only little bit of formalin. What happens is this does not let the tissues properly get fixated, and it many times leads to drying up and autolysis of the tissues.